presenting all these different wonderful presentations that will give us wisdom, knowledge, and understanding. We are grateful, Lord, and we want to ask you to continue to bless her. We want to ask you, Lord, to bless each and every one of us. With thanksgiving, I pray. In Jesus' name, amen.
Amen. Thank you so much, my beloved sister, for the prayer. And for those who are joining us for the very first time, if you do not know me, my name is Angela Hewitt, and I'm the founder and director for 2Health Ministries and Ministry. And we meet here every Tuesday night at this time for Let's Talk Health. So please don't wait for a flyer. Don't wait for an invitation. We are meeting here every Tuesday evening. Okay, so thank you so much for joining us. And as usual, I'm going to be playing our theme song. And please, guys, prepare yourselves. You know the questions I'm going to ask you, right? So don't let me have to be begging you. Don't let me have to be calling on your names. In fact, I should see your hands going up right now. So I'm going to be playing a theme song, and then you know the question. What is disease according to the definition of disease, as you will see from the Ministry of Healing in the song? And what 4 things should we do once we have identified that there is a disease? So stay tuned for our theme song. And after that, before the theme song, let me share a little bit about our speaker this evening. Our speaker this evening, her name is Dr. Danisha Dodd. She is a naturopathic doctor, and we do have something in common, I see there. She has an interest in women's health, as you can see from the topic this evening. In her private practice, she focuses on the individual as a whole person. She treats the underlying cause of disease and provides the right environment for the body to heal itself. She educates her patients on the importance of prevention, and she teaches them how to care for their bodies. She sees patients online anywhere in Ontario. In her free time, she enjoys singing, trying new recipes, and playing with the family dogs. Ladies and gentlemen, put your hands together as we wait with bated breath to hear from Dr. Danisha Dodd. Before she comes, I'm going to be sharing our theme song. And I am leaving this on the screen deliberately because you guys know the questions. And let me see the hands. What is disease? And what 4 things must we do once we have identified that we or somebody we're working with has a disease? So let me see the hands. Otherwise, I'll be volunteering people. Okay, now I'll stop sharing the screen. What is disease? And anybody can give a response. What is disease? Come on, guys. Our presenter need to know that you guys are good students, medical missionary students. Where are you? What is going on this evening? You just time is going. You guys are letting me down. I don't think I did a very good job in the training at all. The fact that nobody can tell me what is disease and what 4 things we must do once we have identified a disease. Thank you so much, Christina. Go ahead, my dear sister. At least you make me not look so bad this evening. Thank you. Go ahead, sis.
Okay, good evening, everyone. So disease is an effort of nature to free the system from conditions that result from the violation of the laws of health. In case of sickness, the cause should be ascertained, unhealthful conditions should be changed, wrong habits corrected. The nature is to be assisted in her effort to expel impurities and to reestablish the right conditions in the system.
Amen. See, thank you so much. So we know we have a bright student who just completed the introductory part of the medical missionary training. Thank you, Christina. Boy, you took the shame out of my face this evening. Dr. Dodd, over to you. I'm sure you're proud of Christina, the fact that she was able to tell us what is disease and what we should do once we have identified a disease. Go ahead, Doc, over to you now.
Hello, everyone. Good evening. Well, it's evening where I am. I'm very happy to be here with you this evening. And I'm Dr. Danisha Dodd, and I'm just going to share my screen so that we can get right into our presentation this evening. Okay. All right. Can everyone see my screen? Just say.
Yes, we're seeing you.
Okay,
yes,
perfect.
Definitely.
Perfect. Okay. So today we're going to be talking about female sexual health, why it's important. We're going to be covering a bit of female anatomy, a bit of female physiology, and we're also going to be talking about some common infections that show up in women. So it seems like Angela and I are on the same page. So what is disease? Disease is an effort of nature to free the system from conditions that result from a violation of the laws of health. You just heard the song just now, and by the looks of it, this is something that you guys repeat every week, so I'm not even going to spend much more time on this. And again, in case of sickness, the cause should be ascertained, unhealthful conditions changed, wrong habits corrected, and then you assist the body in removing impurities and establishing right conditions. So the laws of health that we're going to be focusing on today are nutrition, exercise, water, sunlight, temperance, so that's self-control and moderation, air, rest, and trust in divine power. So to start us off, what are some challenges that we see in women's sexual health? Well, one of the challenges is that it can be taboo. So some of the diseases, some of the conversations that we'll be having today are considered taboo and they're not talked about enough, which means that there's not enough education on this topic. And people tend to go to the internet to find the information that they should be getting from their parents or even from school, but some of this information isn't talked about. There can also be shame and embarrassment around different conditions. And my hope is that, through the presentation today, we will realize that the conditions that we'll talk about are just like any other conditions and require treatment just like any other condition. Overall, there is limited research on women's health topics. And so I know right now there is a push to do more research on women's health. And another reason why there are some challenges is that women's bodies are sexualized. And so because of that, there might be, or this might be a reason why people may not want to talk about certain women's health topics. But like I said, I really hope that this can be a safe space for us to discuss those topics. And if there are mothers here or children here, I hope that you have a safe place at home where you can speak with each other and share what's going on, share, what's healthy, what sickness looks like, and support each other in getting the appropriate treatment for those conditions. So this evening, we're going to talk about the vulva, the vagina. We're also going to talk about the cervix, the uterus, and some issues with fertility. So this picture here, this is a picture of the external genitalia. So we can see here at the top, this is the fatty tissue, the mons pubis. We have the labia majora, the labia minora here, coming together, forming the clitoris at the top. And then we have our urethral opening. So this is coming from the bladder. And then we have the vagina, which is actually part of the internal reproductive system. So now looking at the internal structures, we have the vagina, and then going up, we have our cervix here. And then we have the uterus, the fallopian tubes, and the ovaries. And this is just to orient us so we know what we're talking about moving forward. So we're going to start with the vulva. So like I mentioned, the vulva is made up of the mons pubis, the labia, the clitoris, and the perineum. And the pH of that area is acidic. So it's between 3.5 to 4.7. And the microflora, or the bacteria in that area, acts as a first line of defense. So there are some common vulvar skin conditions. And with these conditions, you can have itching, pain, soreness. You can have change in skin color and texture. And these symptoms can get worse over time, depending on if that area is being rubbed constantly, and if you're wearing like scented products, or if you're sweating in that area. And this is from the RCOG, that's the Royal College of Obstetricians and Gynecologists. And so that same group, the RCOG, they came up with some guidelines for feminine hygiene. And I'm just going to go through them really quickly because I'm assuming that we know most of these guidelines, but this is just a refresher. So you can use a small amount of soap and water to clean the vulva. And you can clean the vulva at least once a day. You can use just your hand to clean it and pat it dry with a towel. It is best to wear cotton underwear or loose fitting silk underwear. And you want to avoid tight clothing, right? Because you want that area to be able to breathe. You can also sleep without underwear if that is your preference. You also want to avoid fabric conditioners because these conditioners may have substances that can irritate the vulvar skin. You want to avoid strong soaps, strong shower gels, scrubs, bubble baths, applying deodorants to the area, baby wipes, and douches, okay? You want to avoid using panty liners and sanitary towels on a regular basis. So obviously, if you're menstruating, you'll use it then. But when you're not, there shouldn't be a need to wear panty liners or sanitary towels. You want to avoid using antiseptics in that area because it can be irritating. And it is best to wear light colored underwear because darker colored underwear have dyes in them. And that's the same reason why you wouldn't want to use colored toilet paper because of the dyes, and those can be irritating to the skin as well. There are also some other guidelines from Middle East and Central Asia. They recommend that you use hypoallergenic liquid wash, so something that would be less irritating. You can also use lactic acid-based liquids, and vaginal douching is not recommended. And we'll talk more about that later. It's recommended to clean the vulva from front to back, and do not use vigorous motion. So you want to be gentle when you're cleaning that area. You want to ensure that you have a safe method for removing pubic hair, ensuring that the tools that you're using are clean and are properly sanitized. And you want to ensure that you're washing your hands prior to children's genital care. So if you have a child and you're taking care of them, just ensuring that your hands are clean during that process. Now, there are some cultural and social practices that we do need to take into consideration. Afro-Caribbean women are more likely to use antiseptic washes and are more likely to use harsh products on the vulvar skin. And so, like I mentioned earlier, it's best to avoid those things because they can irritate the area and make the conditions worse. You want to reduce your frequency of using panty liners, and again, ensure that if you're removing your pubic hair, that you do it safely. So one of the conditions that we're going to talk about here is genital herpes. Genital herpes is caused by herpes simplex virus, and it can affect different areas. So it can affect the mouth, the skin, the lips, the eyes, and the genitals. And there are different triggers. Usually stress is a big trigger. Diet can affect the development or the recurrence of genital herpes. You can have immunodeficiency. So if you're feeling sick or you're immunocompromised, that can affect it as well. And if you consume alcohol. If you have many sexual partners, that can cause genital herpes or contribute to that. And direct skin contact is an issue as well. If you've had a previous history of STIs, and genital herpes can also show up with flu-like symptoms as well. So some of the signs and symptoms that you'll see with genital herpes includes pain, itching, burning, and tingling. You can have bumps and blisters in the area that can actually rupture and bleed. And typically antiviral medications are used, and you are advised to avoid sexual contact during that time. So what are some natural options that you can consider if you have genital herpes? Well, one of the things we need to do is address the risk factors. So if someone has multiple sex partners, then we would want to address that. If someone has different triggers, so stress, or if they have poor immune function, poor diet, those things need to be addressed as well. So when we are supporting the body, we want to provide immune support. We want to address their diet, so nutrition, ensuring that they're eating a whole foods, plant-based diet, getting all the nutrients that they need. Antiviral nutrients can be used as well, such as vitamin C. Lysine is one that is typically used for herpes, and zinc can be used as well to help maintain immune function. Some topical agents that can be used, vitamin E can be very soothing. Tea tree oil and lemon balm, these are essential oils. And if you're going to be using those, you have to use them with a carrier oil because those oils are very strong and they can irritate the skin. St. John's wort can also be used topically, and DMSO gel can be used to relieve pain in that area. Hydrotherapy can be used as well in the form of sitz baths to help relieve pain in that area. So now we're going to talk about the vagina. So the vagina is a fibromuscular canal, and we know that the vagina is an internal structure, and it extends from the vulva, which is an external structure, up to the cervix. So the vagina is self-cleaning, so there is no need for us to clean that area. And throughout our lives as women, the vagina has, or the vaginal fluid has different pH levels. So before menstruation, so that's pre-menarche, the pH is about 7, so that's a neutral pH. During your reproductive years, the pH is about 3.8 to 4.5. Then when you go through menopause, the pH is about 6.5 to 7, so leaning more towards the neutral side, and that's without hormone therapy. And then with hormone therapy, it's about 4.5 to 5. And the microflora, or the bacteria in that area, are very important to maintain the health of the vagina. So the bacteria in that area can be affected by different things. So that includes age, hormone levels, whether you have infections, hygiene, like we talked about earlier, sexual intercourse, medication, and hormone replacement therapy. So all of these things can affect the health of the vagina. And vaginal discharge is normal, right? So you want to know what is normal for you. So normal can be scant discharge. So that means there's not a lot of discharge. It can be clear, it can be white, or it can be milky. So you just want to identify what normal is for you. But there can also be abnormal vaginal discharge. So if there is an odor to it, if your discharge has different colors, so if it's yellow or green, those are reasons to go seek out medical attention. Other things that are concerning is if that area is itchy and if you develop lesions or blisters in that area. So this is just a picture showing different things that affect the vaginal flora. So we had age, lifestyle, diet, the gut microbiome. So definitely the food that you eat can affect the flora in the vagina. Contraception and hormone replacement therapy, antibiotics. So basically the same things that I mentioned earlier, and ethnicity can also play a role. And we'll see that when we talk about bacterial vaginosis. And this picture is a graph showing the changes in the microflora, or the healthy bacteria, and how that changes throughout the lifespan. So in childhood, you have low lactobacilli, so that's the healthy bacteria in the vagina, and the pH is neutral or alkaline. As you enter the reproductive years, the lactobacilli increases and your pH is more acidic, which is the healthy pH of the vagina. When you go through perimenopause, you notice that the healthy bacteria starts to decrease and the pH at this time is leaning more towards the neutral side. And then after menopause, the lactobacilli continue to decrease and your pH is neutral. So this is just really good showing how the estrogen levels, so our estrogen levels change throughout the cycle, throughout our lifespan, and how the estrogen levels actually affect the microflora and the pH. So we're going to talk about 3 vaginal conditions. We're going to talk about bacterial vaginosis, vulvovaginal candidiasis, and vaginal atrophy or atrophic vaginitis. So starting with bacterial vaginosis, so this is actually an imbalance in the bacteria in the vagina, and it is caused by Gardnerella vaginalis. And so the type of discharge that you would see if you have bacterial vaginosis is a gray thin discharge, and there's usually a fishy odor. And associated with that is a pH over 4.5. So normal pH of the vaginal fluid is 3.8 to 4.5. And African-American women are 2.9 times more likely to be diagnosed with bacterial vaginosis. So this is the ethnicity component that I mentioned earlier. So bacterial vaginosis can increase your risk of developing other infections. So that includes chlamydia, gonorrhea, herpes, HPV, and HIV. And it's also a risk factor for pelvic inflammatory disease. And in that one, you have a lot of pelvic pain. You can have abdominal pain as well. Endometritis, so that's inflammation of the endometrium. an amniotic fluid infection, which can affect the baby and baby's health. So the risk factors for bacterial vaginosis include unprotected sex, douching, and taking antibiotics. So what can we do to address bacterial vaginosis? Well, we want to stop douching if that's something that we're doing. We want to avoid tight clothing. We want to wear cotton underwear if possible. You can use oral antimicrobial herbs. So that would be like garlic or golden seal. You can take oral probiotics as well as vaginal probiotics. Vaginal suppositories can be helpful as well. And you want to soothe those irritated tissues. So you can use something like vitamin E oil for bacterial vaginosis. Diet also plays an important role for bacterial vaginosis. So we want to ensure that our diet is full of nutrients. We want to have low glycemic index foods. So these are foods that do not spike our blood sugar as much. We want to lower our fat intake. So this is talking about our saturated fats and our trans fats. And we want to eat foods that are high in folate, vitamin E, and calcium. So these are our green leafy vegetables. And what they found was that the vaginal microbiome diversity was higher in vegetarian women than non-vegetarians. So here we can see the impact of eating a whole foods plant-based diet on the microbiome in the vagina. And this is something that they're actually working on. They're working on vaginal fluid transplants. And this is for a women that have recurrent bacterial vaginosis. So you can see that this is a big problem, such a big problem that they're working on vaginal fluid transplants. And so what they do, they would take a healthy female and test her vaginal fluid, ensure that it's healthy. And then they would transplant that into a woman that has recurrent bacterial vaginosis, hoping that it would replace the bad bacteria and bring back the health of the vagina. So this is something that they're working on. But, you know, right now we can focus on, you know, those healthy habits that I mentioned earlier. So next we're going to talk about vulvovaginal candidiasis. And again, this is an imbalance in the microflora of the vagina. And this one is caused by Candida albicans. And so when you have candidiasis, there's no odor, right? Compared to bacterial vaginosis where there was a fishy odor. This one has white curdy discharge. There is some irritation and erythema, so that means redness, and there is swelling of the labia. The risk factors that are associated with vulvovaginal candidiasis include use of antibiotics, pregnancy, because the hormonal changes can affect the microbiome in the vagina, exogenous estrogens, so that could be through the oral contraceptive pill or hormone replacement therapy, and sexual activity, so too many sexual partners. So one of the first things that we consider is a Candida diet. So we want to ensure that we are eating healthy. So we're eating our fruits and vegetables, getting our fiber, healthy proteins, healthy fats. Again, no douching, no tight clothing. We want to ensure that we're wearing cotton underwear to help in that area. Antifungal treatments can be used. So that would include probiotics. Sometimes garlic is used, or boric acid suppositories can be used as well. And again, we want to address immune function because we want to help the body to get rid of this infection. And we also want to address our blood sugar levels. And this could be addressed, one way this could be addressed is through the Candida diet, ensuring that we aren't having those processed foods and high sugar foods, but that we're having a balanced plant-based diet. Another STI, or an STI that we're going to look at now, is chlamydia. So chlamydia is caused by Chlamydia trachomatis, and you can have infection of the genitals and the eyes, and it's easily spread. And sometimes you don't even see the symptoms. Now, risk factors for this includes having multiple sex partners, unprotected sex, and if you have a pregnant mother with chlamydia, she can pass that on to her baby. So the symptoms, like I said, sometimes it's asymptomatic, so you don't even know that you have it. But if you have symptoms, you would see a white vaginal discharge, you would see dysuria, so that's pain with urination, urethritis, so that's inflammation of the urethra. You can have inflammation of the cervix, you can have pus in your urine, you can have bleeding after sexual activity, pelvic inflammatory disease, proctitis, that's inflammation of the rectum. You can have an oral infection and conjunctivitis. So you can see that you not only have inflammation in the genital area, but you can also have it in the pelvis and in the eyes and the mouth as well. And looking at gonorrhea, this one is caused by Neisseria gonorrhea, and it has similar risk factors. So unprotected sex, having multiple sex partners, if you have a history of sexually transmitted infections, and again, the pregnant mother can transmit this to her baby. Symptoms of gonorrhea, you will have a more cloudy vaginal discharge with this one. And then the main differences, or some of the differences, include pharyngitis. So you can have a sore throat, you can have dermatitis, it can affect the heart, causing endocarditis, affecting the brain, causing meningitis, and you can have arthritis, so affecting the joints. So in general, with chlamydia and gonorrhea, we want to focus on detoxing, right? And it's ideal if you can work with someone to help with the detoxing process. You want to boost immune function, right? Because we want to help the body to fight this infection. You want to ensure that the person has good nutrition, right? So all the things I mentioned earlier, avoiding refined and processed foods, ensuring that blood sugar levels are well managed, because we know that too much sugar can depress our immune system. We want to have our antimicrobial herbs, and we can also use hydrotherapy depending on the severity of the symptoms. So I wanted to talk a bit about douching. So douching is when a stream of water is inserted into the vagina. Sometimes herbs are also added to this water. People normally use it for vaginal infections, inflammation of the cervix. However, as we'll see later on, douching is not recommended because it can affect the vaginal secretions. It should not be used if you have normal vaginal secretions, if you're pregnant, if you're menstruating, or if you have conditions that haven't resolved after 3 days. So douching isn't recommended. And here are some reasons why. It can actually change the flora within 10 minutes of use. And it can actually introduce bacteria higher in the genital tract, which is something that we do not want, because it can contribute to preterm labor and affect the baby. Douching is associated with pelvic inflammatory disease, ectopic pregnancy, bacterial vaginosis, chlamydia, low birth weights, preterm labor, and even cervical cancer. And in the study that I cited there, it says douching is more common in women with low education, low socioeconomic status, and African American women. And I think part of that could be this idea that we need to ensure that that area is clean. But remember that the vagina is self-cleaning, so we shouldn't need to douche. Another practice that I've been hearing more about is vaginal steaming. So this has been used traditionally in different cultures, where they would boil a pot of water and they would add herbs to it as well, and they would sit over it and allow the steam to rise and rise up to the vulva. And the thought is that the vaginal tissue is so absorbent that it'll absorb whatever herbs are in that steam. This is very anecdotal, but it is used traditionally. They use it for postpartum care, period pain, vaginal infections. But the people that do steaming, they recommend that you shouldn't do it on your period, not if you're prone to spontaneous bleeding, not if you're pregnant, and not if you're trying to conceive around ovulation. So the last condition that I'm going to talk about in this section is called atrophic vaginitis. It's also under the term genital urinary symptoms of menopause. And so this typically happens when there is a reduction in estrogen during menopause, and low estrogen affects our vaginal tissues. So symptoms that normally come up with this condition include painful intercourse, decreased lubrication, there can be some bleeding, there's definitely vaginal dryness and burning and itching, and you can have a shortening and tightening of the vaginal canal, and you can also have urinary symptoms as well, which can increase your chances of developing urinary tract infections. So you actually have estrogen receptors in the vagina, and the purpose of estrogen there is to stimulate the growth of lactobacilli. So this is the healthy bacteria in the vagina, and this healthy bacteria helps to maintain that healthy pH, so 3.8 to 4.5. However, when you go through menopause and your estrogen decreases, then you have less lactobacilli, your pH increases, and you have more of that, you have microbial imbalance in the vagina. And so if you look at the picture here, on the left side, you have a healthy vagina. It's pink, the tissue looks plump and healthy. But then when you have a decrease in estrogen, you see that the tissue is pale, the tissue has become thin, the vaginal canal has shortened. And so these contribute to vaginal atrophy, right? So that lack of estrogen. So vaginal atrophy actually affects a lot of women, age 51 to 60. And about 17% of women from ages 18 to 50 have experienced vaginal dryness due to stress or improper hygiene, swimming pool and hot tub chemicals, and even some washing powders. So again, we definitely want to be careful of what we're using on our vulva and in the vagina. So some treatments that can be used for this include vaginal moisturizers. So these actually help the tissues to stay plump and prevent thinning of the tissues. Lubricants are recommended during intercourse, and topical estrogen can be used, and that's via prescription. Now, when you are considering lubricants or moisturizers, you want to avoid certain things in those products. So those would include phthalates and parabens. These are endocrine disruptors. Glycol is an alcohol. And so if that's in, let's say, your lubricant or your moisturizer, it can actually, over time, dry out the vaginal tissue. Glycerin and maltodextrin, these are sugars, and they can actually affect the balance of the microflora in the vagina. And you want to ensure that they have little or no fragrance, because that can be irritating. So what can we do if someone has atrophic vaginitis? Well, we want to ensure that we support their hormones, ensure that they have hormonal balance, and we can do this through diet. So ensuring that they're eating healthy, and eating things like soy and flaxseed can definitely help. There's some herbs that are beneficial for this. So black cohosh, chaste tree, red clover can be useful as well. Seed cycling. So this is using seeds to help to balance our hormones. So these would include seeds like flax seeds and pumpkin seeds, sunflower seeds, and sesame seeds. Sexual intercourse is encouraged. It may be painful at first, but it's kind of like, if you don't use it, you lose it. And then there are topical things that can be used outside of the lubricants that were mentioned earlier. So vitamin E can be used, and hyaluronic acid moisturizers can be used as well. And the body actually makes hyaluronic acid to keep the skin nice and plump. And so it's actually an ingredient that can also be used for vaginal dryness. So now we're going to touch on the cervix. So we're going to talk about cervical dysplasia. And cervical dysplasia is when you have a growth of abnormal cells on the surface of the cervix. They can be pre-malignant, and they're caused by the human papillomavirus. So this is something that we want to be aware of. The risk factors include having multiple sex partners, smoking, if you've had a vaginal birth before age 17, and if you have poor immune function. So cervical dysplasia has different classifications. So it can be mild, moderate, or severe, depending on the type of cells that are found on the cervix. And the typical investigation involves doing a pap test, then progressing to a colposcopy, where they actually go in and visualize the cells on the cervix. And they might need to do a cervical biopsy, or they'll do excision, so removing those cells. So what can we do for cervical dysplasia? Well, we definitely want to avoid smoking, because that's harmful not just for our cervix, but for our overall health. We want to avoid saturated and trans fats and simple carbs. So we want to be eating, again, our whole foods. 6 servings or more of fruits and vegetables are recommended. And papaya is one of those foods that's been found to help with cervical dysplasia. When it comes to supplements, indole-3 carbinol has been studied to be helpful for that. Vitamin D is important as well, and vitamin D is actually important for all women's health conditions. And then a green tea extract can be used internally or topically. I just want to briefly touch on female sexual dysfunction. This is a very complex topic, and I think I only have about 2 slides on it, but I just wanted to mention it briefly. So there are a few symptoms or ways to determine if you have female sexual dysfunction. That would include a lack of sexual interest or arousal, reduced erotic thoughts, reduced initiation of sexual activity, reduced pleasure in sexual activity, and reduced genital sensations. And so this would require like an in-depth assessment to determine, what the symptoms are, but also what's contributing to these symptoms. And so, like I mentioned, this would need to be in depth and would need to be done with a health professional. So what can we do? Definitely need a proper assessment to determine what the cause is, but there are some supplements that may be helpful for this. So that would include vitamin D, ashwagandha, ginkgo biloba, tribulus terrestris, and maca. So these are some herbs that can be beneficial for improving sexual function, but it just depends on the reason for sexual dysfunction in the first place. So now we're moving on to the uterus. And I want to touch on the menstrual cycle. So menstruation can actually tell us a lot of things about our overall health. It can tell us about our thyroid, our digestion, stress levels, mental health, anemia, endometriosis, PCOS, pregnancy, and menopause. And these conditions also affect our menstrual cycle. So it's very important for us to know when our cycle is, how long we're bleeding for, what symptoms do we have during our menstrual cycle, before our menstrual cycle, because it can definitely help you to identify what's going wrong. So this picture is just to briefly show us what's going on. So if we look at the top here, this is just showing us what's going on in the ovaries. And so in the first stage of the cycle, that's called the follicular phase, you have your follicle that's growing. And then in the middle of the cycle, you have ovulation. So this is when the egg is released, and what's left back forms the corpus luteum, and the corpus luteum produces progesterone. Now, when we're looking at the uterine lining, in the first 5 or 7 days, we have our uterine lining shedding. So our estrogen and progesterone levels are really low at this time, and that causes our uterine lining to shed. And then depending on the hormones that are coming from our brain, like those brain signals coming down to our ovaries, then that'll determine when our endometrial lining starts to rebuild. And that's usually in response to estrogen. And then after ovulation, so after the release of the egg, we have progesterone being formed, and progesterone helps with the maturation of our uterine lining. And this section is the luteal phase. So what are some characteristics of a healthy period? Well, we want to ensure that the blood is red color. Now, some people have, black or really, really dark red. You definitely want to get that checked out because it should be a bright red or a saturated red color. You should have little to no cramping. Average blood loss is about 35 to 50 milliliters. And you should hardly have any clots if you have a healthy period. It should come every 25 to 35 days. And you should have less than 3 days of spotting and 3 to 7 days of bleeding. Now, this is just showing you what the blood loss would look like if you were using pads or tampons. Light, this is how many you would use over those 3 to 7 days. Normal, using 6 to 10 per day. Sorry, 1 to 5 per day, 6 to 10 per day, and heavy would be if you're using, more than 16, right? So I want to quickly touch on ovulation because especially if someone is trying to get pregnant, and just so you know, you cannot get pregnant anytime, right? You can only get pregnant with ovulation. So we're going to touch on 3 ways that you can identify if you're ovulating. And ovulation is not just important for pregnancy, right? Because when you ovulate, you produce progesterone, and progesterone is that hormone that makes you feel calm and helps to balance your mood as well. So we're going to talk about basal body temperature, cervical mucus changes, and the position of the cervix. So when we're looking at cervical body temperature, with this method, you would be measuring your body temperature every morning at the same time. So you'd wake up, set your alarm for a set time, get up, get the thermometer, and measure your blood pressure every day throughout your cycle. So initially, your blood pressure, your body temperature will be going up and down. But then when you ovulate, you will notice that there is a spike in your body temperature, about 0.5 degrees, right? And so once there is that spike, it will tell you that you have ovulated because you've produced progesterone. So progesterone is a warming hormone. And so it actually causes your body to be warmer. So once you've noticed that spike, that tells you that you have ovulated. So this one, you can only use it afterwards, right? So this one tells you I have ovulated. Now to find out if you are ovulating, you can check your cervical fluid. So when your cervical fluid is slippery and stretchy like this one here, then that means you're in your fertile window. That's the time when you're likely to get pregnant if you're having a sexual intercourse, right? But outside of that time, your cervical mucus can be more scant. And then looking at the cervix itself, when you're not ovulating, the cervix is low and closed. But when you are ovulating, the cervix is higher. And so you would have to insert a finger to see where your cervix is. And so it will take a little while to identify where your cervix is and to get an idea of what it feels like. And they normally say it feels like the tip of your nose. So that's what you're feeling for. And so if it's higher and you're correlating it with your body temperature and cervical mucus, then those are 3 signs that you can use to determine if you're ovulating. Now, when it comes to fertilization, the egg that is released, it lives for about 12 to 24 hours, but the sperm lives up to 5 days. So if you are thinking about getting pregnant, or if you don't want to get pregnant, you want to be aware of that window. So when you've ovulated, if you do want to get pregnant, you want to ensure that there is sperm around either a few days before and a few days after you've ovulated, just to ensure that there's sperm there to fertilize the egg. Now, female infertility is a big problem, and it's the inability to conceive after trying for 1 year. And so I know a lot of women are struggling with infertility, and there are a lot of reasons why someone can be experiencing this. So it could be related to age. It could be if they have a history of STIs. They may have abnormalities, so cervical or uterine abnormalities. It could be due to medications, hormonal imbalances, immunological incompatibilities. It can be due to metabolic disorders. So this could be like, diabetes. Poor nutrition and lifestyle can be a factor. If someone's not ovulating, that's a factor, because as we said, you need to ovulate, you need to release that egg in order to get pregnant. There can be tubal obstruction, so obstruction of the fallopian tubes, and the IUD can be a factor, and exposure to toxins. So the treatment obviously would depend on the cause, but in general, you want to reduce oxidative stress. You want to ensure that there's appropriate blood flow to the pelvic area, and you want to support the overall, whether that's supporting the mitochondria, supporting endocrine function, supporting hormonal balance. And you can do that through diet and supplements and nutrition. So you want to avoid smoking and alcohol. You want to ensure that you maintain a healthy weight, doing moderate exercise daily if you can, reducing environmental toxins and stressors on the body, a healthy diet, again, maintaining healthy blood sugar levels, and some supplements that can be considered that's dependent on, what the main cause is, would be melatonin, CoQ10, inositol, and NAC. So my role as a naturopathic doctor is to guide patients towards optimizing their health. I want to ensure that people have the resources to improve their diet and lifestyle. I want to provide evidence-based information and provide a safe place for them to talk about these topics openly without judgment, and to be comfortable talking about some of these topics that seem to be, very taboo in our society. So I just want to say thank you for listening to the presentation today. I've included my website if you want some more information on me, and my email if you'd like to reach out for any reason. But yeah, thank you for listening. Are there any questions? I'm just going to stop sharing here. Okay.
Thank you so very, very much for your presentation. Very, very informative.
Mm-hmm.
I see people are just coming in. I knew that somehow the time difference would have caused confusion. For those who came on late, sorry guys, but we're sticking to the 7 o'clock. I know it's early. For those in Jamaica, I know it's going to be an hour early for you, but we're sticking to 7. Once we start at 7 EDT, it means that we're able to finish earlier. But if we start at 8 o'clock, then at 9 o'clock, after 9, we're still going to be here. So for the time change, just remember we're starting at 7 on a Tuesday evening. Thank you so much, Doctor. Very, very informative. And please, for questions, raise your hands, or comments, raise your hands. You'll be allowed to unmute yourselves. One question, Doctor. I remember some time ago, there was a research showing that women, older women, 60s, 70s, were showing up with STIs. And they were saying, why is it that, and these women were faithful Christian women at home, and they're coming up with these STIs. And what I noticed from the research that you have shown is that the older woman gets, she's more susceptible because the acid in the vaginal area is no longer as strong. The bacteria, that is not as acidic as it should be. And so she's now more susceptible. And the research showed that older men were going outside, of course, feeling that they're still young or being with younger women and carrying home these kind of STIs to these older Christian mature women who were being faithful and at home. But I could see now the correlation because she's more susceptible based on the fact that the bacteria is not as acidic to help to kill some of these viruses or whatever should be at risk of getting. So yes.
Exactly. I see a question here in the chat. Is panty liner safe to wear? So if you can get cotton panty liners, I know they have a lot of new products coming out. You can try those, but ideally you don't want to be wearing them every day, right? So if you're menstruating or if you're bleeding a little, let's say before your period or after your period, then that's fine. But ideally you shouldn't need to wear them every day. If you do need to wear them every day, then that might be something to speak to a healthcare provider about.
Any more questions, guys? You can raise your hands for questions. So have you noticed that based on the research that I'd seen some time ago regarding older women, and the question was asking why was this happening? But then of course the research came out. Have you noticed that in your practice that older women somehow seem to be more susceptible?
Well, I do see older women, but I haven't really seen many with like vaginal concerns. But it does make sense, right? Like you said, as women get older and as that estrogen decreases, then you are more susceptible to those conditions because you don't have the healthy bacteria anymore. And so women might have to resort to using moisturizers, right, to help to maintain the health of the vagina.
Oh, question for you. You also mentioned about, especially when it comes to the vaginosis where the muscles are not as strong, and especially for women getting older, 50s up, and they're not sexually active. What if this woman still is dreaming of getting married? She's not active. So it means, as you rightly said, if you don't use it, you're going to lose it. Now, what advice would we have for these women? Because they're saving themselves to be married later on. And me now, I tend to say, literally going to waste in quotes because they're not using it, so they're losing it. And eventually they get married at 55, 60, whatever age, and they're having issues because they were keeping it, storing it, and now they're having issues. What do we say about that? Because a lot of women, Christian women, are waiting and maintaining themselves because we want to live according to the principles of God's words. So what do you say to these women, doctor?
What I would say is if the Lord has you waiting, you wait. When the time comes that the Lord provides someone for you, you can, and this is if you're having an issue, right? If by then you have, vaginal dryness or you feel like the tissues are tight, there's no harm in using vaginal moisturizers or vaginal lubricants. If everything is fine right now, if there's no itching, no burning, then there's no need to use it. But if you are experiencing vaginal dryness symptoms, then you can use the moisturizers and the lubricants.
Perfect. Thank you for the response. Any questions? Somehow tonight, our audience seemed to be very quiet, unusually quiet. Is it the taboo topic that we've touched on tonight? And that is why we want to create that space where it's no longer a taboo to speak about these matters, because I've been reached out by women with a chronic yeast infection. I noticed we didn't touch on that tonight. I've been reached out by at least 5 women.
I touched on it. Candida. I talked about Candida.
Yes, you did. And I noticed that I've been reached out by at least 5 women with herpes. And so we're not talking about these things. We make it so taboo to the point
Yeah.
where if we decide to speak about these things, nobody wants to talk about them. But we need to, because just like diabetes, hypertension, heart disease, or whatever else it is that we're dealing with on a daily basis, these are
Yeah.
stuff that we deal with, right? One young lady who reached out to me regarding yeast. It's chronic and it occurs so often. She has difficulty with getting yeast infections so often. So I know she was saying to me that she washes the area with soap and she even uses a rag to insert and wash. I'm saying to her, no, you don't need to be washing inside with a rag. Vagina is self-cleaning, no soap. So in fact, I need to check on her again to see if she got help, because she was using a really good probiotic and that was helping her. So I want to see if it has been occurring since then. So Carol, I see your hand. I'd seen Veronica and there was another hand. So go ahead, Carol, and then Veronica, you can raise the hands that were up. Go ahead and raise back your hands.
Okay, let me see if I can say this right. When you talk about the cervical, the cervix and the uterus, if one have an hysterectomy, is the cervical a part of the uterus that is removed with the hysterectomy?
If it's a complete hysterectomy, then the cervix is usually removed.
Okay, so what if the ovaries are left, but the uterus is
So if the ovaries are left, then are you asking in relation to a condition?
Yeah.
Well, none of the conditions we mentioned today had to do with the ovaries, except for when we were talking about menstruation.
Okay.
Mm-hmm.
So everything should be fine.
Mm-hmm. As long as you don't have any symptoms.
Yeah. Okay. All right. Thank you.
Okay. You're welcome.
Thank you, Carol. I'll jump over to the chat. I see Sharika is asking if boric acid is safe to use. When you say safe to use, do you mean externally to wash the area? Is that the question you're asking, so you can get a more specific response? You could respond, Sharika. And how about using uva ursi for urinal? Yes, definitely uva ursi is excellent for urinary or bladder issues. So yes. Are you okay? Somebody mentioned that she's doing vaginal exercise for those muscles. Yes, good. Doc, you want to talk a little bit about doing, especially for the women who are waiting and you're worried that you might get all seized up and atrophy starts setting in. What kind of exercises can we do to help for the women who are waiting, not married, and not sexually active?
I mean, I haven't delved into vaginal exercises, but I know one of them, they do those exercises with like pelvic floor physiotherapy. But I know one of those exercises involves just like tensing the area and releasing. The only thing I would say is as long as some people get easily aroused, right? So as long as you're doing those exercises in a healthy way, then that's fine.
Okay.
Yeah.
More questions, and then we're going to take Veronica. Sometimes I tend to overlook the chat, so let me take some from the chat and then Veronica. Okay. What about using Dettol as a rinse?
So that's not something I would recommend, but I know traditionally, like, because I'm Jamaican, so I know traditionally I've heard of Jamaicans using that as a rinse, but mostly with like postpartum. That's when I've heard of it being used, but that's not something I would recommend.
Thank you. What if a woman in the past had STI? Does it ever go away? STD, that's the question in the chat. Does it ever go away? An STD if a woman has had that in the past?
It depends on your lifestyle, right? So if you are doing all the things that we mentioned, following the 8 laws of health, we know that God is a healer and he can heal
Amen.
any condition. So, and he can put anything in remission. So as
Amen.
long as you're working on your health, then by God's grace, it can go away.
Amen. I love that response because I've heard people say, and we always say as medical missionaries, we all, especially on this platform, that every disease is curable. Don't let any doctor tells you that you must live with this for the rest of your life, including herpes. We keep hearing people saying, oh, we have to live. The doctor say I have 3 months to live, or I must live with XYZ. No, God has the final say where our health is concerned. And he's a healer, able to heal and to make new. That's what he says. I am the Lord that healeth thee. That's the promise of God. So yes. And then, so Veronica, then we go back to the chat. Yes, Veronica, you go ahead, and then Garth, we'll take you after.
Good evening, everyone. I was going to ask the question about the chronic yeast infection because I am close to 55 and I find myself like every 6 weeks I would have it. But when I spoke to my doctor last, he said something about estrogen level. So I am not sure what it is that I need to do. But everything I do, I wear the cotton underwear. I hardly wear panty shield because I do sometimes have a bladder issue. So if I don't go to the bathroom quickly, then I might have an accident. But the answer was the question was partially answered earlier.
How old are you, Veronica?
55, she says.
Oh, 55. Yeah, so I'm gonna assume that you're postmenopausal now. So yes, your estrogen would be going down, and so that's gonna affect the health of the vagina. So I don't know if your doctor recommended like hormone replacement therapy or any like vaginal estrogen. If you don't want to use hormones, you can always use moisturizers like a hyaluronic acid moisturizer that can be beneficial for the vagina.
Thank you. And I'm happy you're touching this topic tonight because we have a lot of women here who are over the 50s and might be experiencing different issues that is caused or affected by age. And I'm so happy the men are on as well, because men, you need to know these things. Your wife is in her 50s, going through menopause or already postmenopausal, experiencing dryness or whatever the situation is. It helps you to understand what is taking place in that woman's body, and also how you can support. What support can you offer? What can you do instead of becoming fed up and then go outside, right? So we're going to take Garth and then Camacho. Camacho, that is. And anybody else you have a question, please raise your hand. Go ahead, Garth. Garth and Camacho.
It's Garth's daughter.
Hey, how you doing? Go ahead, my dear.
Is the vaginal cream safe for children?
I've never looked into it for children. What does the child have? Does the child have a condition?
Let me let her unmute herself again. Yes.
I just wanted to know.
Okay, I've never used it or recommended it in children. And so I would definitely want to know what the issue is before saying, before giving an answer.
I agree totally, because a child is supposed to be healthy
Mm-hmm.
and should not be involved in any way at all. So,
Yeah. Yeah.
okay, so back to the chat, and then we're going to take Camacho. Would yoni eggs be recommended?
I know that yoni eggs are used traditionally or have been used traditionally in the past to help with, let's say, strengthening the pelvic floor, helping to tighten the vaginal tissues, helping with prolapse. So if that is something that someone wants to try or has tried, I don't see any harm in using that.
Yeah. And for those who
Yeah.
know of Dr. Barbara
O'Neill,
O'Neill,
yes.
she speaks a lot about the yoni
She
eggs. So for
does.
women,
She
if
does.
atrophy setting in, weak muscles, whatever, I
Mhm.
guess you could definitely try the yoni stones or yoni eggs. You might see
Yeah.
the words being used interchangeably. What
Mhm.
proportion carrier oil and tea tree oil? That's someone asking.
Mm.
The proportion.
I would use like if you have like a 10 ml bottle, 10 milliliter bottle, so that's a really small amount. I would use 1 drop of tea tree oil. Test it on your skin first, so like your hand, then maybe test it on a more sensitive area, so maybe your inner thighs, and before trying it on your vulva, just to be
Okay.
safe. Yeah.
And a question, she said she's 57, she doesn't get wet, which we understand what that question is. Is that healthy?
Mm-hmm.
And let me just, another part of her question, so you can answer it both at the same time. She says, could this also be another reason why older women are getting infections? So the lack of moisture.
Yeah, so it's all related to estrogen, menopause, low healthy bacteria, affecting the pH. So if that area is dry, if the tissues are irritated, if you're not sexually active, if you're having, let's say, bleeding in that area from the dry, cracked skin, then definitely give the moisturizers a try. Because like I mentioned, the moisturizers and the lubricants, they're not, well, the moisturizers, they're not just for, if you're sexually active, they're there to maintain the health of the tissues. So the same way you moisturize your skin after you take a shower, right, to ensure that your skin is not dry and not cracked, it's the same thing with the vulva and the vaginal tissues.
Okay. Sharika, she's referring to the boric acid capsules that can be inserted. So
yeah, so boric acid suppositories can be used. Yeah.
Okay, Camacho, your turn. And then there's another question. Any more questions? Raise your hands. Go ahead, Camacho.
Okay, good night, everyone. I have 2 questions here. First one is, what do you think about the wild yam cream to balance your hormone?
Wild yam cream, I know that's something else that Barbara O'Neill recommends, and I would say it's worth a try. However, that's not the only thing you should be doing, because the wild yam cream takes a while to work, several months. So while you're doing that, you should also be doing the diet and the exercise and all the other things that we talked about to promote healthy hormonal function.
Okay, and the second question is, what do you think about pap smear? Is it healthy? Is it necessary for someone who is 50 and over to continue taking that annually or biannually?
So it's usually given to, well, it's testing for abnormal cervical cells. And this normally comes up if you are sexually active, right? So if you're sexually active, you have multiple sex partners, then that's definitely something that screening is definitely necessary for that. If you're
Mhm.
over 50, I believe the screening guidelines is every 3 years. So you can double check with your healthcare provider, but I believe it's every 3 years. Yeah, for that.
Okay, there's a question here. So a person goes to say for instance that every year a person goes to take a pap smear and
Mhm.
it's normal, it's always normal. Should that person continue taking an annual pap smear, whether or not they are 50 or below?
So that's a conversation you would need to have with your doctor because I don't know your overall history, right? It's hard for me to say yes or no. But I even looked over the guidelines for screening for cervical cancer today, and they have updated the guidelines, I think, in 2013. So if you are between like 30 and 69, you should be screened every 3 years. If you're lower than 30, it's usually believed that because you're healthier, then your body should be able to clear an HPV infection pretty easily. So there's, you don't usually need to be screened at that age. So you could double check the screening with your healthcare provider. But from what I looked at today, it's every 3 years that you should be screened.
Yeah,
If
but
you are healthy, then that is a decision you will need to make to say, do I want to continue this or do I want to stop it? But I cannot give you that answer. That's a decision you have to make.
Okay, thank you. Fair enough. Okay, thank you.
You're welcome.
Thank you. And as the doctor mentioned, it's not just using one thing in isolation. Remember the 8 laws of health. Nutrition is key. She had pointed out some foods, and even in consultations that we do with women, especially who are having dryness, eat foods that are rich in moisture. For example, your okra, she mentioned the flax seeds, your chia seeds, your seeds on a whole. Drink a lot of water. So you want to be ensuring that you're nourishing your bodies, not just using one particular herb or the yoni stones or the wild yam in isolation, but a combination. Practice the 8 laws of health as well. Get your vitamin D and all these things were talked about. Christina, go ahead, my sister.
Oh, sorry, I was trying to unmute. Okay, so my question is, I live in the state of Florida, right? And I'm a single woman. So like every night when I take my nighttime shower, I like to go to bed free, you know. So is it a good practice to go to bed like without wearing underwear when you when you take your night shower, when you're ready for bed? Because that's what I do. So I just want to know if it's a good practice or not.
Oh yeah, that's totally
Oh,
fine.
definitely.
No issues with that one.
Okay, all right, cool. Thank you.
You're welcome.
Oh yes, sister, be free. Rose B, go ahead. Camacho, do you have another question? Camacho, another one? Rose B, your turn. And
Hi,
then
good
Rita
evening.
after that.
Good evening. I just have a question to ask. I'm having this test done every 3 years for my breast examination. And the machine that they use in Toronto in Canada, they give you 2 different tests, the ultrasound, and they give you the machine that grabs the breast, and that one is very painful because I'm chesty. I don't like using it. Do I have to use get that particular test with the machine that really sucks?
The mammogram.
Yeah, mammogram.
So it is recommended to do mammograms. What was your last result?
It was okay. I had a lump many years ago. I was going through a lot of stress. I had a lump. And because breast cancer runs in my family by my mom, I was tested and I'm okay. The lump disappeared many years ago. I've been tested every 3 years. And because of my age, I have to get a test every 3 years. But the machine that I don't like when they presses on the breast, because I'm really, really, really heavy there. And it hurts like, I think that one gives me lumps because it's really painful.
I agree.
Yeah. Again, this is sort of similar to the other question. So I cannot say whether you should or shouldn't continue with this screening test. That's a decision that you would need to make on your own. And like I mentioned before, I would need more information. I know you mentioned family history, but there are other factors related to that as well. So unfortunately, I cannot give you an answer here, but that's a decision you would need to make.
When they see the same thing from the ultrasound, when they put the gel and the rubber machine, like when they see the same, if there is any lumps or anything,
So usually when you're older, they do the mammogram. So ultrasound is usually for younger women, and then they do the mammogram. And especially since you've had a lump in the past, they would just continue with the mammogram.
Okay. All right. Thank you.
You're welcome.
Thank you. Let me go back to the chat. Someone is asking if coconut oil is safe to use in the private area.
If you like to use coconut oil on the vulva, go right ahead. The only thing I would say is if you are using it for lubrication, so like for sexual intercourse and there's a condom involved, the coconut oil can break down the condom. So that's the only issue there. If you like coconut oil, that's fine.
Okay, let me see any more hands. Rose B and then Rita, go ahead. Or that was Rose B a while ago?
Yes.
Okay, so Rita, your turn, Rita, go ahead. You can unmute.
Thank you. Yeah, I had put something in the chat, but I think it was overlooked probably. But I was thinking that if you have a woman who's a Christian woman who's being pure and she's married, isn't it possible that she could get an infection if her husband maybe has a shower? You know how men are different than us. They think differently, some of them, most of them. But anyway, like they would maybe wipe the behind instead of the front. I mean, wipe the behind first instead of the front. And then, continue wiping their body, or maybe wipe their feet and then wipe the private area and then come to bed and has relations with the wife. And that could be a reason that she could be getting infections. Does that make sense?
So you're saying...
Hello?
I can hear you. Can you hear me? Hello?
Yeah, no, go ahead. We're hearing you.
Okay. I mean, poor hygiene can affect the health of the vulva and the vagina. And then, these infections depend on other factors as well. So your diet, if you're eating processed foods, if you're not drinking enough water. So I can't really say, okay, you'll get this infection, but your daily habits and the habits of your husband or spouse can affect the health of your vagina.
Agreed.
Thank you so much. Okay, any more questions? Okay. Yes, I do take probiotic. I've never had a vaginal infection or any. All right, so interesting information in the chat. Okay, so Dr. Wilson saying that she's a doctor. She's been vegan for 41 years. She's just gone through menopause at 60. She's had no complications that women tend to have: no night sweat, no mood swings, no infections. She just stopped getting her menses. So she's as healthy by practicing the 8 laws of health. She's full of energy. God is good. Thank you for that testimony, sis. At
Yeah, that's
60, and if she's
good.
still going at 60, women, at 40, if you're married, you can still be going. You can be going at 40 and 50 if she's still going and full of energy at 60. So we need to take a page from her book, Be Healthy. Yes, she said she takes probiotic. It's good to take a very good probiotic, ladies. Yes, drink lots of water. Is the vaginal wash good to use on your vagina? That's a question. Oh, she's 66, she says. Vaginal wash, do you recommend those?
Yeah, so the vaginal wash is the douche, right? So in the presentation, douching is not recommended because it can affect the vaginal flora. Now, I know that this is something that is done in many cultures. People do douching and they add different things to it. I would just caution you, if your vagina is healthy, if you're having healthy discharge, do not start this practice. If you have a condition, get checked by a healthcare provider before doing anything. I know we DIY a lot of things, but it's better to know what's going on before you start doing anything so that you don't make things worse.
And there's also a vaginal wash, which is a liquid format as well. You find them in different brands. For example, Eve, it says gentle, no scent, no parabens, no alcohol. So maybe she's also referring to that wash instead of the douche because she mentions the wash. So you'll find them in different brands in pharmacies. So pure water, I find just water alone is good also. If you're healthy, water is enough. Okay, I don't see any more questions. Dr. Dodd, thank you again so very, very much for such an informative presentation. A lot of people turned up late tonight because of the time change. I'll emphasize we're starting at 7 p.m. Eastern Daylight Time. For Jamaica, it's going to be 6 p.m. on a Tuesday evening. I know it's a bit early, but we have to give and to take based on the time change. Thank you so much, everyone. We're going to close off officially, and then afterwards, we normally stay back and we socialize and say hello to those who are on. So let's close off officially with a prayer. Then after that, if you do have questions or comments, then you're free to share. Let us pray. Loving Father in heaven, we thank you for the blessing of tonight. Thank you for the knowledge that you have given to Dr. Dodd and the willingness of her to share with us freely. We thank you for all the persons who joined us tonight and for the women who may have had concerns, whatever the questions or concerns are. We surely hope and pray that tonight's information will help to make a difference in their lives. We thank you for the men who have joined us as well, because they can provide support to their wives. We thank you for providing this platform. Many persons tried getting on as well and could not join us because they were having problems with their Zoom or the internet. But we know that you'll continue to make the way possible and know that this information is available on YouTube. People can have access to it. So we commit ourselves into your hands tonight. Be with us as we depart from this platform and as we join Friday evening for Sabbath devotion and Sunday evening for our Bible study. We pray that you will bring us back together again once more. We thank you, loving God, for hearing and answering our prayers. For Christ's sake, I pray. Amen. Thanks again for joining us. We meet on a Friday evening for our devotion right here, this same platform. And we meet where we have been looking at final event series, Bible study, where we're looking at prophecies, the fulfillment of prophecies, what is happening and what is to come. Join us at 6:30 on a Sunday evening. Same Zoom information. Don't wait for a flyer nor an invitation. Just join us Friday evening, 6:30. And Sunday evenings at 6:30 as well. Okay, I will allow you to unmute yourselves if you got questions after the fact or just something to share, or you want to say hello. So let me see the hands, or if you can unmute yourself and tell us if this was your first time, who invited you and how did you find the presentation tonight? So anybody joined us for the first time tonight?
I did.
You did, Rita. Oh, tonight was your first time. Where did you join us from?
From Birmingham, England.
Oh, you're joining us from the UK. Okay, Rachel
Yes.
normally joins as well from the UK, as well as Margaret, but I'm not see. And Kathleen. Oh, I see Kathleen. Is Kathleen on from the UK as well? Maybe, but yes. Well, thank you for joining us, Rita. We hope you join us again.
Oh, I loved it. Thank you. I was invited by Daniel in Trinidad.
Okay.
I don't know. We've never met, but God is so good. 2 years ago, somebody put on a program, and it was just at the beginning of the COVID era, and I asked a question, and the answer came back from Daniel John, and then a couple of weeks ago, I had a question about something, and who answers? But he didn't know that he was answering to me. But I remember the name. And so I finally got the courage, and I called and I said, I think I know you. He said, well, I don't know you. Who are you? I said, well, 2 years ago, you answered a question, and now you've answered another question. And so he went back in his archives and found my name. And so here I am. So thank you.
Well, thank you for joining us. And Anne-Marie Lake as well normally join us from the UK. Thank you, Rita. See you next week, Tuesday night, or on a Friday evening at 6:30, or Sunday for a Bible class.
Oh, thank you. Okay, good night.
You're welcome. Good night. Queen Liz from the US, thank you for joining us. Dr. Wilson, yes, I've been sharing in the Country Living group, but thank you for joining us. We meet here every Tuesday night. Thank you for joining us, my sister.
Hi.
Rita, oh, yeah, you can take it on your hand.
I love it. I get on late, but my sister invited me, and I'm thankful and blessed for the little information that I learned tonight. Thank you, guys.
Oh, that's Miranda. Where did you join us from, Miranda?
Yeah,